our last startup of the day, but definitely not least, is Alphonse Carnicero Carmona, founder and CEO of Able. Alphonse, give me 1 second and I'll add you to the screen and you'll be able to present.
Thank you, Jim. Hello, everyone. Thanks for having me here. I'm joining from Barcelona, Spain. So, do you see my screen now?
Yes, we could see your screen now. And I can hear you loud and clear too. So whenever you're ready, you can go ahead and start and we'll start the timer.
Okay. Mobility is something most of us take for granted. Did you ever imagine your life, how your life could change after a disability? This could be your perspective when crossing the street and looking to people. And this, the challenge you would face to reach a bottle of milk. Currently, 1 billion people worldwide see their mobility and independence compromised due to a neurological disease, being the most common causes stroke and spinal cord injury. These people could walk again if they had an exoskeleton. However, current devices are very expensive as they cost about 100,000 euros and too heavy, weighing over 25 kilograms. Therefore, they are only found in large hospitals and are out of the reach for the patients and many small clinics. This is why we present Able, a new generation of exoskeletons that are 2 times lighter and 3 times more accessible than current solutions. It comes together with an innovative cloud-based mobile app for a personalized and data-driven therapy. Able technology has been born to change the rules of the game, providing efficient rehabilitation and inclusive mobility for all. In this video, you can see Ricard, who is paralyzed from waist down due to a spinal cord injury, walking again with the Able exoskeleton and with total independence. A strong patent portfolio ensures protection of our innovations, and we also have a certified quality system by BSI. Our technology has been tested by over 100 patients who walked more than 100,000 steps. Clinical trials have been performed in leading clinical institutions like Institute Goodman and Heidelberg University Hospital, showing improved clinical outcomes and benefits in rehabilitation. Our product is currently undergoing the certification process as a medical device and will be commercially available next year. Market interest has been confirmed, receiving pre-orders for over 300,000 euros in just a couple of months. Our business model leverages product sales for 40,000 euros with annual recurring revenue streams for the software part.
10 seconds.
Our team combines over 50 years experience in the medtech industry. We have been recognized the best European robotics startup in 2020 and accelerated by Toyota Startup Accelerator led by ISDI. Our disruptive technology is on a mission to empower every person in a wheelchair. Let's make this happen. Thank you very much.
And time. All right, Alphonse, awesome. Congratulations on what you've built so far. I'm sure there's going to be plenty of questions, so we'll go ahead and open up to the media panel. And just a quick reminder, if we could also score along as we go, that'd be very helpful. Not to break away from our trend today, Abhimanyu, thank you, sir. Please go ahead and start us off.
Thanks. Alphonse, thanks for the presentation. Can you tell me about a little bit more about the competition in this space and how you might be able to cut through the noise there?
Yeah, this technology, exoskeleton technology, started like over 15 years ago, and it was started because of the military space efforts. So the main companies are from Israel, the States, and Japan, and are big corporations, but they have 2 products or 3 products only in their portfolios, and their products are much more expensive than ours and offer. What we have done is to offer the features from all the competitors in just one device and also a reduced price.
And can you also tell me, what is your next big challenge, in bringing this to the market and and achieving ubiquity?
Yeah, for us, the main challenge is to be able to certify this device under the new medical device regulation in Europe. which is something that we are currently working on. And once this is done, then we can unleash the product in the European clinical institutions. And then after that, once it's properly introduced, the biggest challenge is to have widespread adoption also for personal use, not only in the hospitals, but also in everyday use.
Thank you.
That is like our late goal.
Yeah, absolutely. I'll pass it on to the next judge to ask questions.
Kit, please go ahead.
So I have two questions. One, obviously, you said there are, it's the big players that dominate, but I'm aware of quite a few small startups or smallish that are trying to do what you're doing. So I'm wondering why none of them have so far broken through. I mean, what's holding it back? And then my second question is actually to do with production. I mean, how many can you produce? How many do you have out there? What if you were trying to ramp up production? Yeah, how many can you kind of produce in a month and distribute?
Yeah. Regarding the first point, so far, none of the competitors, either startups or big players, have been able to do such a drastic reduction in the price and the weight. And this is because we have done several innovations. We have some patents that we have been granted several competitive projects because of this innovation that we did with the research group here in Barcelona, and also afterwards during 3 years in the startup. Especially, for example, the bottleneck to design exoskeletons are the actuators. So we have developed our own actuator technology that has been patented and that offers unique characteristics in terms of weight and size and price. And this is something that differentiates from all the competitors in the space. And regarding the second question, production, this is something that we are currently working on to increase our production capabilities. So far, we can produce 1 exoskeleton a week, but we are working to raise money so we can expand our production facilities and be able to produce 1 exoskeleton a day.
We'll go ahead with Alfred next.
So very exciting product, Alphonse. Is this intended to augment people with limited mobility, or can this work for somebody who's completely paralyzed? And following up on that, is this a product that produces a natural gait, or I mean, how is the steps activated, controlled by the wearer?
Yes. Regarding the first question, what we have done is the first product of our technology targets the population that has the clearest need. That is the people that has lost all the mobility. So what we do is to restore this mobility. But we're already working on a second product that is a device for a stroke. In fact, a stroke is why I started this. My father had a stroke, and this is why I devoted my studies and later my career to this field. And a stroke is different than a spinal cord injury because normally you lose just part of your mobility. So there, what the device does is understanding which is the remaining part of your motor activity that you still preserve, and only helping with the rest. And we have future ideas for future products also in this area of enhancing mobility, and more for the elderly population, also a growing target group. So we started for the more clear need, but we have the willingness to expand to other potential markets. And the steps of these products, there are 2 ways to trigger them. One is in the beginning, when the patient is learning, the therapist is triggering the steps from the back of the exoskeleton. So each step is triggered with 2 push buttons by the therapist. But afterwards, when the patient learns how to do the weight shift from one side to the other side, the device understands it and is the parameters are personalized to each user. So then it's automatically triggering each of the steps, providing a natural gait pattern.
Thank you very much. That's great.
Thanks.
Hey, Heather, please go ahead.
Yeah, thanks for your presentation. This is really interesting. So do you plan on selling this product directly to patients, or will you sell to hospitals? How will the business model work?
Yes, in the first phase of the company, our customers are clinical institutions, both private and public. And this, the business model would be product sales, 40,000 euros like transaction for the sale of the product. And afterwards, we will have recurring revenue streams, 2,000 euros per year for all the service that we provide, including the software subscription. And afterwards, our ultimate goal, and the mission of the company, is to provide mobility not only when you are in the hospital or when you are in an outpatient facility, but also at home. This is why we're already developing innovations to have these exoskeletons also in a personal or community environment. But this will come after a couple of years.
Thanks, Heather. Go ahead, Manu.
Alphonse, I also want to know, are the exoskeletons customized to each patient, or is it the same device that can be configured, on site and with the software?
Yeah, great question. The device for clinical use, this first that we have now, it has adjustable segments that are adjusted, telescopic segments that are adjusted to each user. And here we have also innovated because we can adjust these segments without any mechanical external tool. The therapist can adjust this and very quickly. And this is very important to maximize the treatment time within rehabilitation. We have done clinical trials and demonstrated that they can put on and take off the exoskeleton in only 6 minutes, which is an advantage from other devices that do it in 20 or 30 minutes. And this is for the hospital use. For the home use, then it will be a device personalized for you. And the software is always adapted and personalized to the needs of each individual. And this is something that you do through the mobile app. Right.
And also similarly, would it be the same product that someone uses when they have, say, no mobility in their legs? And then, and would it also be the same product for someone who has limited mobility, say, due to injury?
No, for a stroke, we are developing another product that is more it's like a boot, like if you have a powered boot.
I see.
It's something like a bit futuristic. We're working on that, and we'll see.
All right. Thank you, and all the best.
Thanks a lot.
Alphonse, I had a quick question too. I think for me, the 40,000 euro cost kind of it sets a barrier, but I'm not sure how in Europe in terms of insurance companies, etc. Kind of are they already adopting similar type products that they're allowing their patients to get and they're covering in the insurance, or what can you tell us about kind of the future of that?
Yes, talking with insurances, we have seen that the 40,000 euros range for personal use will still be like a barrier for wide adoption. This is why we're still working to keep pushing the price down. We have seen that they are more used to cover devices that are on the price range between 10 and 20,000 euros, like electric wheelchairs or these kind of devices. 40 is a bit more, but this is something that we still have years to develop technology so we can reduce this price, and also it's something that will scale up a lot with the volumes that we were able to manufacture.
All right, well, awesome. And yeah, really great work. Congratulations again. Thanks for staying up late with us too. I know it's getting later over there in Spain. So